Hi everybody, today we will see meninges of the brain. What is meninges? The central nervous system, that is a brain and down the spinal cord, is covered by a membranous layer. Here is a picture of the skull and the brain, and in between the brain and skull you can see the layers of membrane. These membranous layers that covers the central nervous system, that is your brain and spinal cord, is called meninges of the brain. What are the function of this meninges? It protects the central nervous system. It covers the central nervous system. So it acts as a shock absorber. When there is a trauma or injury to the brain or blow to your head, it absorbs the shock and helps to protect your brain and spinal cord. It anchors the central nervous system. That is, it helps to keep the brain from moving within the skull. It also acts as a support system. It has blood vessels, lymphatics, CSF, cerebrospinal fluid, and nerves. So act as a support system for this. Now about the meninges has three membranous layers, that is outside dura mater, middle arachnoid matter, and innermost is pia mater. So the innermost thin delicate layer that sticks to the brain or adheres to the brain, you can see in this picture as a purple color, that sticks to the brain is called pia mater. And in between there is arachnoid matter. This is the middle layer and it has a web-like appearance. And the outside tough layer, which is close to the skull, is called dura mater. Now let's see the spaces of the meninges. Meninges has three spaces: epidural, subdural, and subarachnoid. So the picture of the skull and the outermost layer is called dura mater. So the space above the dura mater or between skull and dura mater is called epidural space. Epi means above the dura mater, that is epidural space. Now space below the dura mater is called subdural space. The subdural space is between dura mater and this is arachnoid matter. The subarachnoid space is between, this is arachnoid matter. So subarachnoid space is between arachnoid matter and this is the pia mater. Clinically, this space is very important because you may see cases if there is a collection of blood in the epidural space, it is called epidural hematoma. If there is a collection of blood in the subdural space, the space is called subdural hematoma. Or if there is a bleeding into the subarachnoid space, it is called subarachnoid bleeding, whereas bleeding in the brain tissue is called intracerebral bleeding. So today we saw meninges of the brain, and thanks for watching my video.